Good evening, guys. Now for discussion D, I want to present something that happens to millions of seniors in the U.S. It's verbal abuse. That's a form of elder abuse for those people who don't understand forms of elder abuse. I'm going to go through that for you and lay it out in a presentation for you. I like the title says, I'm certified in elderly healthy aging. So we're going to go through that for tonight's topic, D, verbal abuse toward elderly. Okay, so here we go. The page discusses how verbal abuse can constitute elder abuse under California Penal Code Section 368. Elder abuse is defined as the willful infliction of unjustified physical pain or mental suffering on individuals age 65 and older or dependent adults. Verbal abuse qualifies if it causes mental suffering through threats, humiliation, or belittling statements. Key considerations include caregiver role. If the accused is a caregiver, such as a nursing home employee, their actions must be willful or criminally negligent. Non-caregivers, if the accused is not a caregiver, their actions must be willful or intentional to be considered elder abuse. Okay, that's one form, guys. I'm gonna go through that now. Second page, give me a minute. Give me 1 second, please. Evidence used in prosecution. Since verbal abuse lacks physical evidence or lacks physical evidence, prosecutors rely on witness testimonies, victim statements, and experts' evaluations from social workers or investigators. Legal consequences. Elder abuse can be charged as misdemeanor or felony, with penalties ranging from jail time up to 4 years for felonies to fines and mandatory counseling for the rest. Okay. Would you like further clarification on any aspect, such as how courts assess mental suffering in these cases? Elder abuse encompasses a range of harmful actions or neglect toward older adults, often by caregivers or trusted individuals that The broader definitions include, okay, let me go through those for you. Physical abuse, inflicting injury through force, such as hitting, pushing, or restraining. Emotional, psychological abuse, causing distress through threats, humiliation, or isolation. Sexual abuse, any non consensual sexual contact or harassment. Neglect, failing to provide basic needs like food, shelter, or medical care. Financial exploitation, misusing or stealing an elderly's or elder's money, assets, or benefits. Abandonment, deserting an elder who requires care. Okay. Elder abuse can occur in various settings, including private homes, nursing facilities. Give me a minute. And assisted living communities. It often goes unreported due to fear, dependency, or lack of awareness. Would you like to explore prevention strategies or legal protections? Preventing elder abuse requires a combination of education, vigilance, and systematic safeguards. Here are some effective strategies. Education and awareness. Inform seniors, caregivers, and the public about the signs and risks of elder abuse. Many cases go unreported due to lack of awareness. Strengthening support networks. Encourage regular check-ins from family, friends, or community organizations to reduce isolation, a major risk factor for abuse. Caregiver training and oversight. Ensure caregivers receive proper training and support to prevent neglect and burnout, which can lead to mistreatment of clients, folks. Legal protections, reporting mechanisms, strengthen laws and reporting systems to hold abusers accountable and provide victims with safe avenues to seek help. Financial safeguards, and educate seniors on financial scams and establish protective measures like trusted financial advisors or legal guardianship when necessary. Encouraging open conversation, communication. Create environments where seniors feel safe discussing concerns without fear of retaliation. Okay, would you like to explore specific legal protections or community-based interventions? Elder abuse prevention strategies vary across countries due to cultural norms, legal frameworks, and healthcare uh, infrastructure. Here are some key differences: legalization and enforcement. Some countries, like the US and Canada, have strict elder abuse laws with mandatory reporting requirements, while others rely more on community-based interventions. Community-based approaches in regions with strong family structures, such as parts of Asia and Latin America, prevention often focuses on family, education, and integrational hold on integrational support rather than legal action. Institutional safeguards. Scandinavian countries emphasize elder-friendly policies, including comprehensive social services and financial protections to reduce vulnerability, public awareness, and education. The World Health Organization recently launched a global database of 89 promising interventions in heightening the need for evidence-based strategies to improve detection and response. Technology and innovation. Some nations are exploring AI-driven monitoring systems and telehealth solutions to detect abuse remotely, particularly in rural or unserved areas. Would you like to explore specific interventions from particular country or region? Cultural factors shape elder abuse prevention strategies by influencing family dynamics, societal attitudes, and legal frameworks. Here are some key ways culture impacts prevention efforts. Family structure and caregiving norms, and in collectivist cultures such as those in Asia and Latin America, elder care is often a family responsibility, reducing reliance on institutional care, but sometimes increasing the risk of hidden abuse within households. Okay, perceptions of aging in societies where elders are highly respected, such as Japan and Scandinavian countries. Abuse prevention focuses on community Give me 1 second, guys. Support and elder-friendly policies. In contrast, cultures that prioritize youth may have weaker protections for older adults. Legal and social protections. Some countries like the US and Canada have strict elder abuse laws with mandatory reporting, while others rely more on community-based interventions. Economic factors. In regions with high poverty rates, financial exploitation is a major concern, leading to education campaigns and financial safeguards for seniors. Stigma and reporting barriers. In cultures where family honor is paramount, victims may hesitate to report abuse. Requiring confidential support systems and culturally sensitive outreach. Would you like to explore specific interventions from a particular country or region? Cultural factors shape elder care by influencing family dynamics, healthcare, access to societal attitudes toward aging. Here are some key considerations. Family expectations and caregiving norms. In collectivist cultures, such as those in Asia and Latin America, elder care is often family responsibility, reducing reliance on institutional care, but sometimes increasing the risk of hidden abuse within households. Perception of aging. In societies where elders are highly respected, such as Japan and Scandinavian countries, care focuses on community support and elder-friendly policies. In contrast, cultures that prioritize youth may have weaker protections for older adults. Healthcare access and social services. Scandinavian countries emphasize comprehensive social services, while nations with limited healthcare infrastructure may rely more on informal caregiving networks. Okay, give me a minute, guys. Okay. Infrastructure might rely on informal caregiving networks. Economic factors. In regions with high poverty rates, financial exploitation is a major concern, leading to education campaigns and financial safeguards for seniors. Communication style and decision making. Some cultures favor family centered decision making, while others prioritize individual autonomy in healthcare choices. Would you like to explore how specific countries address elder care challenges? All right, guys, so that is C for you, or D. So I will be back on with E shortly. Give me a minute for E, please, and I'll be back on with you for it. For now, Gator Wellness, take care.